We will end this course discussing the topic that isn't the most exciting aspect of the profession of athletic training, but it can be considered one of the most important aspects of the profession as a whole. By the end of this discussion, you will be able to understand the necessary records that must be maintained by the athletic trainer, understand how to maintain medical records securely, and understand the different components of a SOAP note. For athletic trainers, as for all healthcare providers, keeping accurate, updated medical records are essential. Because lawsuits are the rule rather than the exception, accurate and updated records are absolutely a necessity. Medical records are also critical for accurate and timely assessment and evaluation of practices and for documentation of practices and activities to ensure responsibilities and expectations are being met. Information should include family history, social history, habits, immunization history, growth and development, substance abuse inquiry, medical encounters, orders and prescriptions, progress notes, as well as results of tests. An electronic medical record, or an EMR, is a digital version of the paper records used in the past, which contains all of the patient's medical history, medication and allergies, immunizations, lab test results, images, vital signs, demographics such as age, height, and weight, etc., and insurance and billing information. EMRs can be easily shared among different healthcare providers, and because of this, simplify the process for any healthcare provider who may need to review a complete medical record for an individual patient between facilities, all the while reducing cost. The downside to using an EMR is that the improved portability and accessibility creates security issues that threaten patient privacy. Confidentiality of medical records should be one of your top priorities as a healthcare provider. The athletic trainer may not release a patient's medical records to anyone without written consent. If the patient wishes to have medical records released to professional organizations, insurance companies, the news media, or any other group or individual, the athlete must sign an individual waiver that specifies that information is to be released at that specific time. The only exception to this is the appropriate disclosure of information among those professionals who are involved in providing health care to the injured individual, such as another athletic trainer on site. These policies and procedures are created by way of the Health Insurance Portability and Accountability Act, or HIPAA, and the Family Educational Rights and Privacy Act, or FERPA. These regulations guarantee that patients have access to their records and dictate who can and cannot have access to their information. A written blanket or authorization must be signed by the patient at the beginning of the year and will suffice for injuries and treatments for the whole year. FERPA, on the other hand, protects the privacy of student educational records. In some instances, such as in the high schools, documents can fall under either category, so it is important to understand both. FERPA gives parents certain rights and respect to their children's educational records, but only until the age of 18 or until the student has moved past the secondary school setting. An injury report serves as a record for future reference. If the emergency procedures followed are questioned at a later date, i.e. for legal reasons, an athletic trainer's memory of the details might be somewhat hazy, but a report completed at the time of injury provides specific information. In a litigation situation, an athletic trainer may be asked questions about an injury that occurred 3 years in the past. All injury reports should be completed in detail for this exact reason. An injury report should contain all information following the SOAP note format: subjective, objective, assessment, and plan. Let's discuss those roles really quickly. The SOAP format is a conscious method of recording the initial evaluation and progress notes for the injured athlete. The subjective portion of the SOAP note refers to what the patient tells the athletic trainer about the injury relative to the history or what he or she felt. This section can include what happened, so the mechanism of injury, when it happened, what type of pain they're experiencing, how bad the pain is at that time of the evaluation, as well as at the time of injury, treatment done already, what they can and cannot do, and anything that has changed lately. The objective portion documents information that the athletic trainer gathers during the evaluation, such as range of motion, strength levels, patterns of pain via palpation, etc. This section includes the following. The assessment records the athletic trainer's professional opinion about the injury based on the information obtained during the subjective and objective portions. And finally, the plan for treatment indicates how the injury will be managed and includes short and long-term goals for rehabilitation. This section also includes first aid, referral, rehabilitation, any form of treatment. In summary, keeping adequate records are crucial to athletic training practice, not only for the better health care for the patient, but also for legal purposes to protect the athletic trainer. As a future healthcare provider, you must understand different types and components of each. You also must keep medical records safe for what has been discussed previously.